webinar. We are so pleased to have you join. Today, we'll be doing a session on emergency and disaster management from a gender and international perspective. As always, this session will feature about 45 minutes of discussion, followed by 15 minutes of question and answer. Feel free to put your questions in the question box at the top right throughout the session, and we'll get to your questions at the end. ASPA is always trying to improve these webinars for you, so if you would take the time to fill out our survey at the end, we would very much appreciate it. And this session will be recorded and posted to our website afterwards. And with that, I'll pass it over to Dr. Romeo Laverius to introduce our panelists.
Thank you very much, Caitlin. Good afternoon, everyone. My name is Dr. Romeo Laverius with the University of Central Florida. I am the webinar subcommittee chairperson for our section on emergency and crisis management with the American Society for Public Administration. The SECM, the section on emergency and crisis management, has a wonderful opportunity to partner with the section for women in public administration to bring you the topic that Caitlin pointed out, emergency and disaster management from a gender and international perspective. We have a distinguished panel. I'd like to introduce Susamma Seeley, Crisis and Disaster Humanitarian Affairs Specialist, Dr. Triparna Velotti, the Associate Professor and Director of the Masters in Emergency Programming at John Jay College of Criminal Justice, Dr. Judy Kruger, Adjunct Associate Professor out of Emory University, and Dr. Lucia Velotti out of the John Jay College of Criminal Justice. Our moderator for this will be our section on emergency and crisis management chairperson, Jason Rivera, who is the professor and chair for the Department of Public Management with the John Jay College of Criminal Justice. I want to thank you all for attending, and I'm now going to turn it over now to Dr. Rivera.
Good afternoon, good morning, everyone, from wherever you are respectively. Before we jump into the panel, I just want to say a few words about our section and also the section for women in public administration. Really have a great opportunity to co-sponsor today's event. The section for women in public administration has been the largest and most active ASPA sections with growing membership and a full range of activities and programs for its members. They welcome both men and women to work together on projects and programs that promote participation and recognition of women at all levels and areas of the public sector. And so if you are interested in joining that section, please reach out to their membership coordinator after our panel today. In relation to our section, the section on emergency and crisis management seeks to improve the quality of emergency management within the public sector. Within the context of numerous statutes, regulations, and ordinances, emergency management can be defined as the process of developing and implementing policies concerned with mitigation, preparedness, response, and recovery. We seek to bring emergency management into the mainstream of public administration discourse and increase its effectiveness at all levels of government. So thank you so much for coming today, and we really look forward to having this panel discussion. So as both Caitlin and Romeo pointed out, today's panel is really about how gender influences various aspects of disaster and emergency management. Although gender has been known to be a very, very important characteristic and dynamic within the emergency management process, within disaster recovery, response, and preparedness, it does not get the attention within the literature and also within general discussion that it really should. And so today we really want to shed a light on not only the disaster and emergency management aspects that we see in research, but also look at the professional side of the conversation as well, and how gender representation within the field of emergency management, both within academia, but then also in the practitioner sense, how that influences how communities get service, and also what it's like to work in that area of public service. Now, before we jump into the thing, I just want to give each individual panelist an opportunity to reintroduce themselves, talk a little bit more about themselves before we get started. So I'm just going to go from right to left on my screen, and I'll start with Triparna. Could you please introduce yourself?
Hello, everybody. Thank you for being here, and I'm excited about today's discussion. I am with Penn State University. I teach in public administration program, and my interest in gender and disaster management is quite personal. My hometown hit devastating earthquake in 2000, and since then I have been interested because I was a newly interested in research and PhD students. So that became like my quest at the time. And also my exposure to gender issues developed more with me being a co-managing editor with the Women's Studies leading journal, Gender and Society. So I kind of overlapped and combined these two. And since then, I have been interested in gender issues in various capacities in nonprofit management and also nonprofits that is working with disasters and with government. So it all overlapped, and I'm excited to explore this more.
Thank you. Lucia.
So hi everyone, I am an associate professor at John Jay College of Criminal Justice and the director of the master program in emergency management. And I am also a member of Adjunct, the initiative for gender equity in public sector. So I am very glad, like to hear what Triparna experience with gender was, because, like my experience with the field of disaster started in a similar way. In fact, like I started as her, right, exactly as a survivor. And so I was a survivor of the 1980 Irpinia earthquake. We had more than 3,000 people dying at that time. And then over my career, like having this strong interest in disaster and having worked also as a research assistant at the Disaster Research Center. After that, like I have done several studies, like I have been in different places that had been struck by disaster both nationally and internationally. And I had an opportunity to really observe the dynamics of gender. But the truth is that I just started developing a research interest in the intersection of gender and disaster just recently. And I'm very glad I did that, because this is a very important conversation, and I am really honored to be here today with all of you to discuss about this. Thank you.
Thanks. Thank you, Lucia. Susamma.
Thank you. What do I say after I go after everyone, right? So thank you everybody for being here today. My name is Susamma, and I come to this space differently than most folks. I left my professional practice as an emergency manager to start doctoral studies because of what I saw in the field. And so I saw problems that I found that I needed to fix, right? And, why did I see them? Well, I saw them because, I came to this country as a young person and as an oldest daughter, as, a female, if you will, in my culture. I'm from India. And I recognized so many of the issues stemmed from either not being seen or not being understood, not being accepted. And I realized that, hey, you know what? I wanted to do something. And consequently, I started doctoral studies. And now I'm here today because I'm interested in not just gender. And, we don't say it as just gender. Obviously, there are so many other aspects. But today's conversation is, I believe, a linking point. So everything that I talk about may start with gender, but I'm always interested in how gender is a starting point for how we can discuss how someone's lived experience affects how we traverse life, and therefore how we can make it through whatever hazard may come our way. And of course, we're going to have some wonderful conversations.
Thank you. And last but not least, Judy.
Good afternoon or good day, everybody. I'm joining you from Atlanta, Georgia, and my background's a little different as well. I pursued the field coming from a public health background and was involved with health security, disease surveillance, outbreak, and epidemic response to a number of different events like West Nile, Zika, Ebola, influenza, COVID, etc. And along the way, as I continued to take a lot of the independent study classes at FEMA, I ended up joining FEMA. And with that agency, where I'm no longer there, I'm now teaching at Emory. I was part of leading 19 different disasters across the country. So I did see a spectrum of how gender is influenced or is related, at least in the applied sense, for women compared to men in a disaster response and management perspective. But my international experience comes from CDC. Thanks.
Thank you. And again, thank you all the panelists here for being here today. But so we're going to jump right in. So our first question that we really wanted to talk about was just thinking comparatively. And what I mean by that, U.S. versus other national contexts around the world. What role does gender play in disaster vulnerability? We talk about how different socioeconomic or socio-demographic characteristics may influence people's vulnerabilities, but gender is one that is always ever present. So how does that affect either the individualized social vulnerability or even the vulnerability of communities? And so does anybody want to jump in, or should I just pick somebody to start? Okay, Judy.
Just say that from my perspective, women operate from a more collaborative and inclusive standpoint. We value empathy, communication, diverse viewpoints, as well as authority and seniority, etc. But I found that in the field, working for the federal government, that the leadership models are a little bit are acted out in a different way. We do seek out inner guidance from a circle of leaders like team leads and division leads, etc., to get collective feedback. But we are a little bit more inclusive, that we drop down as well to the level of the applied field person to be able to get their input. And this, I feel, helps us to be more inclusive and possibly serve the community as a first responder network to help them in their recovery.
Thank you, Judy. Triparna, how do you, from your perspective, your research, your work, how do you see gender influencing social vulnerability to disasters?
I think Judy is spot on that inclusion of women and also men and sensitize men towards gender differences is important, and inclusiveness is really important at every step. So not just at the organizational level where disaster management professionals work and provide services, but also at the cultural level, at the structural level. All these places creates barrier, economic barriers, cultural barriers. For example, when there's tsunami in Indian Ocean, more women died just because they were never taught swimming. They were never taught or allowed to climb trees. And so these are cultural barriers, and it has nothing to do with the actual disaster or at the time of the disaster, the services, etc. It's more about culture and inclusiveness. So it's very important, even when there's no disasters going on, the culture needs to include women and address gender issues.
Lucia, go ahead.
Yeah, if I may, I would agree with Triparna and what she's saying. Basically, what she's saying is that when we think about gender, the problem is not gender in itself. But what is really problematic is the social, what we would call the social structure of gender, meaning all those expectations that are attached to gender and how, you know, cultural norms shape gender. And so, you know, this is very important, you know, because we can then, you know, really explore vulnerability across all the spectrum of gender. So gender, not just in its binary category, like men, and women, but also, thinking about sexual and gender minorities. And so, Jason, to your question, which was a very important one, what you saying was about what are the differences between the United States and the rest of the world. I really would like to talk about, first of all, what is the common ground that we share actually, and which is at least, like from the research that I have done so far, it's really, like the paucity or research studies on sexual and gender minorities. And actually, this is such an important topic, like because the minute we do not research about them, the minute in which we do not include them in emergency planning, along all those minutes, along all that time, this population becomes invisible, and it is even more vulnerable. This is, without taking away anything, from the importance, like of vulnerability. Also, like in terms of the way in which, women experience disaster. And the way in which I see, like women experience disaster, the differences, like primarily between the United States and the rest of the world, like maybe goes back a little bit to what exactly Susamma was saying at the very beginning. She was saying, when I think about gender, like in disaster, I just think as a starting point. In fact, like we also need to think about the intersectionality of gender and how it intersects with race, gender, and how intersect with class, like, and once again, gender and how it intersects with culture. When we think about culture, there are some countries, like that are really dominated by patriarchism, in which women have, as also highlighted before by Triparna, right? Like they experience disaster in a different way. For example, they might be limited in mobility, or they are just relegated to primarily helping behavior, like taking care, of elderly, taking care of children, and this make them tremendously more vulnerable, especially like at times in which they need to protect themselves and their loved ones.
Thank you. Susamma, did you want to comment on this first question?
I actually, first of all, I love the conversation and the direction that we're taking in, and I wanted to just kind of piggyback on what Triparna was saying about what happened after the tsunami. The number of women who perished, it wasn't only about the fact that they're not allowed to learn how to, or allowed to climb the trees and to learn to swim. It's also these expectations of caring for the elderly, caring for the the young ones, right? And I'm sure if Triparna had more time, she would have expanded into that, right? So I'm going to add into these expectations, and Lucia, you would say this too, that these expectations of having to care for everyone around, right, limits what we can do for ourselves, because we don't just do for ourselves, we have to do for everyone else. And this actually links back to the point that Judy made earlier about the collaborative effort. And I just want to keep emphasizing that when we have these conversations about gender, we are really having conversations about how the communities can be helped, right? How policy is going to be changed, because again, it's not just about individuals. It keeps coming back to the collective.
And thank you, Susan. I mean, a lot of what's been said so far really overlaps with what our next kind of motivating question is. But the notion of how gender intersects with public policies and social structures that may in some cases pose a severe challenge to people of various either binary gender categories or people of different identifications or intersectionalities. It's exceedingly important because it's not really like, as you already have mentioned, it's not a men versus a women type of situation. This is a situation where we're talking about gender in a more profound way across a variety of different social dynamics. Susamma, is that your hand again? Yeah, go ahead.
Yeah, I apologize. I know you didn't want to go into men versus women for this, but when you're talking about something specific that happens when we consider gender, I'd like to read everyone something that I pulled from a World Bank Group report. It came out in 2021, but it's something that everyone can access, and I'm going to read this. Gender-based violence, a manifestation of systematic inequality between men and women, is exacerbated during a time of emergency. Violence tends to increase in the immediate aftermath of a disaster, and women and children are at greater risk of physical and sexual violence in emergency settings, owing to a lack of adequate data on the incidence of pre-disaster event violence. It is difficult to measure the scale up of violence. All right, there's more to this, but owing to the lack of data is also about, hey, we don't know what happens in people's homes before this stuff. We include poverty, we include all these other situations that people experience, the social dynamics, the socioeconomic status, everything. And this gender-based violence is an increased risk, but intimate partner violence is also an issue with this.
Triparna.
Susamma, you are so much on point, because every time when any disaster happens, even during COVID here, we see numbers increased of domestic abuse with women and children. In fact, when they were keeping our schools open, we had a dialogue with our school administrators, and they said, we just keep this open so that those who are vulnerable to this kind of situation, abuse, domestic violence, they have an outlet. Kids can come here because the environment at home might not be safe for them. And I was a little shocked, because I thought I live in a developed country, and schools is just for education, and it just opened the entire different side of the society to me. Same thing happens with India when they are in the camps, after disasters. The sexual violence and sexual abuse goes skyrocketing, and just because of the vulnerabilities, people trade resources in favor of sex, and these sexual violence is one of the very important thing, and it does have man versus women kind of thing there. Even though we are not talking about that, it's a reality, and sometimes we have to address that as well.
Thank you. And so just not to get away from what we're talking about, but I really want to continue this conversation because you've already really touched on how either gender dynamics and intersectionality affects disasters and how communities respond to disasters, both at a group level, but then also at an individual level. I'm curious, really, how do these dynamics impact the way communities or families respond specifically or recover from disasters? There's a lot of research that has emerged in relation to how women are central to the community recovery process, particularly in places that are especially in developing nations, but then also predominantly within the United States as well, depending on context and situations. So I'm curious what you could say to that dynamic. And I see Judy's hand up first.
Yeah, happy to answer that. So I want to summarize that women have different social roles and responsibilities, and even access to resources. Our care responsibility, for the children, older adults, or individuals with disabilities may limit our ability to respond, or in this case, recover. And I also will say often we don't have, it could be in this country or other countries, access to the disaster warnings. And we may not have access to transportation. It just depends. Internationally, individuals, women, I think it was mentioned, typically don't get educated at the same level. And definitely in the rural areas, well, women are the ones who are doing a lot of the farming. They're doing the water collection. And if there's flooding or drought or anything that hits their harvest, they're really going to be vulnerable.
Thank you. Lucia.
Yeah, thank you. So this is very interesting, like, first of all, when we think about, like, especially, like women, like in a post-disaster context, what happens is that we oftentimes, like also during Hurricane Katrina, we observe women involved in the so-called helping behavior. So they start taking care, as we said before, about, like the children community. They start organizing events, and they are very, very much involved in the rebuilding of their communities. This is because, like they have a very strong sense of attachment, emotional sense of attachment, like to those places. So we really see women, like potentially being as a great resource, like for entire community. However, one thing that we shouldn't discount is that the impact that all of this has on women in terms, like of mental health, like in terms of burden, because oftentimes, especially the strong support network for women are disrupted in a disaster. And so, like, women now, they have less people on which to rely on. At the same time, so we need also to take into account, like how, like men, like play also, like a very important role in the rebuilding of communities, right? Because oftentimes we look at them, to, especially, like in response, right? To demonstrate their bravery, to demonstrate their capacity, like to respond in a strong way. And so, like, oftentimes even men, like they have difficult times, for example, in expressing their emotions. And so they also can be, in fact, like very vulnerable. But when we think about them, like, we really need to think about, like how, like they also contribute, like and benefit to their community.
Thank you, Lucia. Susamma or Triparna?
I think there are so many layers to this, and that's when it comes to intersectionality, a part of it. So I'm not sure which one I should pick. It's just too many things coming to my mind popping up. But mental health definitely very important. Also, again, the structural barriers sometimes, and the expectations, social expectations, also play a role, because in research on, I think, one of the Katrina or one of the storms that happened, and when evacuation orders were there, women were the first one who actually packed their bags and forced their families to get out. So they took the lead, and men kind of followed them. But when everything was over, they went back to their more of a domestic care, looking after kids and elderly and all, and men became like a public face of what's happening and trying to manage outside. So again, it goes back to the role expectation. And even though sometimes women take lead in certain situations, it's not always continuous in that way. And that's why it's important that they are trained also, not only to really take leadership role, develop skills like swimming, etc., but also to oppose these stereotypes, to recognize the stereotypes, and then try to work with other genders to make it more inclusive for everybody.
Susamma, did you have a comment? Or so what we've talked about so far is a lot of the social and policy and cultural challenges that women face in this particular situation. I also would also like to highlight some of the notions of how important women are in the recovery process beyond the caring or more therapeutic types of activities that have been kind of highlighted so far. But women across a number of case studies that are in the research illustrate how women are exceedingly important in both the reconstruction of the informal economies of places that experience disasters, in addition to the formal economies of bringing people back to disaster areas, right? In many cases, women are the ones that restart businesses, both formal and informal, where possibly men do not return to the site of disaster. And so when we think about gender and what the way it plays is not just on the more soft social side of the coin of recovering from disasters, and also the public health side of recovering from disasters. This is a severe economic impact that they have in restarting communities as well. And so this kind of leads us to the next question I have for all of you, that really stems from kind of both not only the challenges, but then also some of the things that we can talk to, the lessons that are learned in other areas or other geographic regions. But what can public and nonprofit organizations do to better support or empower people based on gender to be more prepared and resilient to natural hazards? And I want to start with Susamma, because you didn't get a chance to jump in last time. So could you speak to this a little? I think you're muted.
Is it? Wait,
I hear you now. I hear
Okay,
you.
great. And you said this is the question about
what can public and nonprofits do to help empower and support?
Okay, sorry. Just wanted to make sure we heard. All right, so I think now is a really great time to talk about paternalism. And for those who, want to do a quick search, paternalism is a really, it's one of those concepts where we are substituting our thinking and our culture and our values and making decisions for other folks and saying, we know what's best. And in this space, and, and as a practitioner, I've seen this unfold in so many spaces. When I went out to work disasters with, the agency that I worked for at the time, when we deployed, paternalism is when we go out and say, we know what's best for you, so much so that we're not going to give you the cash. We're going to pay that company because we don't trust you. And by the way, that is driven by not just your gender, but by any of the social dynamics, all of your social identities, right? And by what we think, how responsible you might be. And so, but paternalism also it is a grave disservice to your agency. And if there is local, indigenous knowledge about how to handle a problem, or maybe that collective knowledge that our local groups, which, a lot of times are women getting together, or maybe even our men's groups getting together, whatever it may be, paternalism gets in the way of letting them handle their own issues in the way that works best for them culturally, within their environments. I'm trying to be as general as possible, given the differences across our countries, across all the, domestically and abroad. So paternalism, no to paternalism.
I'm reminded of conversations related to the BRIC legislation and how communities were cited as being resilient or not resilient, and communities going, what do you mean we're not resilient? We've been here forever, and in the absence of any intervention, and you're going to tell us we're not resilient. I'm sorry, Triparna, go ahead.
Yeah, and paternalism happens where mostly men who are making decisions, because women are not included in decision making. Also, there is minority who are working within this structure. So what happens is that, and there's a great example from I think Turkey earthquake, where they came up with these policies and programs, and they completely neglected focus on women and their safety. So in the end, UN Women intervened, and they kind of created another layer of programming which only focused on gender responsive preparedness. So so it is very much there. I know it all and I did it, but that doesn't work in this situation. You need to understand others who are living the reality that you are trying to address. Susamma, you're so right about this.
Judy.
So as the two other presenters had said, I think it's important to involve women in all stages of decision making and partnering. For example, being part of a community advisory board, helping women get these micro grants or job recovery programs, and also in partnering with community groups that offer training. When I was doing some work in West Africa, for example, for polio, we had a lot of women who they had coloring books, and second, they had these flip chart graphics on how to prevent polio, and women could connect with other women, especially in some areas where there were some religious barriers for women to engage with men. And then finally, plays and theater. Often they were put on in the community or in schools. And because they had to work with educating individuals who didn't go to school, it was a great way to really help implement ways to encourage at least disease resiliency at that time.
So if I may add, I just would like to add that to how, can public and nonprofit organization better support, and empower people based on gender. So what I was thinking is that, a little bit on a different side, what I said at the very beginning, what is really, really important is that, first of all, we need to have more research, that funds the study on gender. And in particular, on non-binary. We already we already have a wealth of information on women and vulnerability but however, that kind of information that we have, unfortunately, it's limited to some specific regional areas. Like we have tons of research in Asia, and also like in North America, but we are missing a lot, on the rest of the world, like for example, Europe and other, and then. So this is number one. The number two, would definitely be we as a public university, as Institute of Education, we should definitely play a role, and we should definitely include in our emergency management programs, both at undergraduate and graduate level, coursework on the topic of gender and disaster, addressing, not only women, but also men and sexual gender minorities. I think this is very important. And I would also couple this with a course on emotional resilience, so that we are going to make sure, that all these problems that we can see, also among our first responders, and also, in us, in across gender, right, all the problem of mental health, at least we give a foundation, of coping strategies. And then, last but not the least, of course, as already some of you have already highlighted, gender inequalities and strategy for resilience should be discussed in emergency planning, and diverse gender representation should be included in those discussions. Yeah.
So I have a question that's bridging off of everything that you said. So I'll wait. I'll hold it until after everything's done for the question and answer session, because it's off script and I don't want to throw anybody. But our next question really we're switching now focus from the disaster survivor, disaster affected communities and individuals perspective towards the profession of emergency and disaster management, and really looking and really trying to examine or get some perspective on what is gender representation like within the field of emergency management? What is the culture or organizational culture related to that, or a byproduct of that representation, and what that might mean for service provision? And I know that's a ridiculously broad and very complicated question, as are all of the questions we've asked today, but we only have an hour. But I'm going to throw this to Susamma first, and then please, everybody, feel free to chime in based on your own personal and also research experience.
Okay, well, as Jason said, this is an immensely complicated issue, but I want to just drill it down to a few things. One, my personal experience, my lived experience is what I'm going to speak from right now. And I want to say that we often forget that how the people who work in emergency management and disaster spaces, how they are treated, how they're acknowledged, how they're brought, also affects the communities or constituencies that they represent. The fact that this industry is filled with lots of white men, lots and lots of white, straight men who are by and large Christian, also very much affects how this plays out. So that affects how I, for example, as a brown woman who came from India, right, who comes into this space. So if they make assumptions about me and what I can do before I even get to the table, right, to the meeting that I'm supposed to get to, or for whatever job that is that I'm supposed to do that I have been duly vetted for, you know, I've already been excluded, which means any folks in the community who I might, you know, understand their situation or what their life is like, or any of the dynamics that they go through, you know, we have a huge problem here. So what I say to this is, when we talk about gender, we often focus straight on what happens to the women without actually asking the question of what are the men doing? How are they thinking? Why are they thinking this way? You know, it's very often that issue of, you know, a woman is sexually assaulted. She didn't just randomly get sexually assaulted, right? And I know we're getting controversial, and you all are probably thinking, oh my gosh, what is she doing? But this kind of very direct and frank language is what is needed in this field, particularly with this administration. You know, we're in round 2 of it, and it is getting worse and worse. And I'm probably should stop right here. Otherwise, you know, you all aren't going to get a chance to speak. So I'm going to stop.
Judy, Lucia, Triparna, you want to chime in?
Well, I will. That's, you know, like, thank you, Susamma, you know, for your words. I know that they came from your heart and from your experience, and I know that many of the women that right now are listening to this webinar, in their heart, they went through the same. And in solidarity, I want to extend a big hug to all of you. Stay strong, please. One of the things I think that she's saying is that also when we think about, you know, like the politics of gender in general, gender in disaster, you know, like we should think about inclusion of women, diversity, but what we should really do is that do it in a way that is meaningful, not just because it's going to be politically correct to do so, but just because in reality we do believe, you know, like also that we are going to add some value, that our perspective as women matters. And that perspective is so important to make not just, you know, like women, for example, more resilient, but an entire community, because what we were discussing before is also the role of women, you know, like in supporting entire communities and society. So until we do not understand that, recognize this, I think we are still far from thinking about how we can make our community more resilient. And this is number one. And then I don't know if there is anybody else that want to add anything to this. And if so, you know, you can talk right now. And then I have another point that is completely unrelated to this. So I would like to have somebody else talk on this.
Jump in. So in the US, 30 to 35% of emergency management professionals are women. And so I see, and of that, 20% are in senior field leadership positions. I see this as a very positive trend. And it's also the same in fire, law enforcement, etc. So I do see the responder culture embracing women, and it's not for everybody as a woman to take on these roles because it does require long, unpredictable hours, and it's really hard to be a caregiver, but there are plenty of opportunities for advancement in the field.
Thank you. And so what, and we talk within public administration, we talk all the time about the notion of representative bureaucracy, well, what that means not only for the communities we service, but then also what it is like and what that contributes to the internal organizational dynamics. But then again, potential issues of paternalism related to the composition of the organization based along not only gender, but then any number of intersectional identities as well, right? And so before I ask my question, that really stems to a lot of what was said. It is somewhat controversial to ask, so I won't be upset if people shy away, although I know two of you probably don't care. Lucia had something she wanted to point out.
Yes, I mean, it was completely different. It was not related to this, when you talk about, emergency management as a profession, we need to acknowledge that emergency management, it's really in an interdisciplinary field with many professional profiles. Among those, I just wanted to talk about, something that is very dear to me, at least lately. I'm carrying out a research with Dr. D'Agostino, which is the co-founder of IJEPS. And what we are looking at right now is a role, of mobile apps in emergency management. And we are really looking at whether or not they are gender sensitive. Usually, when we think about mobile apps, they are deemed as to be gender neutral. However, while gender neutrality make everybody equal, right? It doesn't speak to equity. And so I thought that this is really important because when we think about, the use of technology in disaster and how, really these mobile apps can make us stronger. Like a lot of times before, I was hearing my colleagues addressing the fact that there are a lot of women that face sexual violence, and especially, when they go to shelters, so it would be very important, for them to know where there are shelters that are not overcrowded, so that, this issue at least can be mitigated, or maybe, shelter that can protect them to some extent, or, other kind of information that can be relevant to women, such as, for example, diverse route, but also just thinking and taking into account, problem, of us, access to phones or digital literacy level, and also about, issue related, to privacy and data protection when we think about, right, women that are exposed to violence. And so, what we are doing right now is that we are really looking, at the role played by gender in technology, which was also something that was advocated by Enerson, Pottergrid, and Peak in 2017. And what we are doing is that we are looking into that, and we are trying to create a checklist to evaluate all the mobile apps that are being developed in emergency management, and understand whether or not they are gender sensitive and how they can be improved. So I think this is something, that it's important to the field, the profession.
Thank you, Lucia. So we're actually out of time for the actual panel discussion, scripted questions aspect. So I want to move over to our question and answer period. So again, if you're in the audience, please provide your questions into the question box. And and I will get those and we will go through them as they come through. So we have a question from the audience. The question starts, thank you all for sharing your thoughts and experiences. But what is something you think women who are entering emergency management should be aware of while they're entering the field? So I'm assuming this is talking about fresh fresh new EM people entering into the field of emergency management. What would you offer as advice to someone to a woman entering this field brand new? I saw Susamma smile. Don't keep it to yourself.
I would say, remember that those time, like in which you encounter some challenges or difficulties, remember that what you are doing is for the greatest good. That's what I would say.
Susamma?
I would also say that gosh, I have so much to say. I would say utilize your social capital and activate all of your networks and make sure that you have mentors from multiple areas so that you know how to navigate across all the disciplines.
Nice. Judy or Triparna?
I would say that it is no different than any other profession in so many ways, that you'll have same barriers in organizational maneuvering, but at the same time, it is very specialized field. It's like none other. Emergencies are very different than the regular running organizations at regular times. So more important is that you have to keep in mind that you can actually bring change by clearly presenting your own voice. Maybe you're presenting a side that nobody has ever thought about. Have more policies that are gender sensitive. Having said that, we don't know how you're going to, how they are going to be received. And I think Susamma and others will agree with that, that so many times we all have seen that we present something which has a gender component to it, and it's brushed off as if nobody has said anything at the table. So all that will happen, but we should just keep going.
Can I just add something real quick? If you're at a conference and the gentleman calls you kiddo, as I've had colleagues, tell me about, you can either ask him who he's talking to, or you can walk away and realize that there is, that is how we women get spoken to. So you can be that change, make that change, and also steel yourself up to always have to read your resume in every room and everything that you go to, and be, and be prepared for that.
Judy, did you want to respond to that question at all?
I'll just say disaster leadership programs are looking for operational leaders, and I just think that men and women have different strengths.
Thank you. Here we have another one. Do you have any recommendations for how one could get involved with professional work in the humanitarian assistance field globally?
Can you repeat the question, Jason?
So the question is, do any of you have any recommendations for how somebody could get into the to get involved with professional work in the humanitarian assistance field, particularly in relation to EM or disaster response or humanitarian logistics, stuff like that?
So I would say volunteer with the American Red Cross, and they have a national and international option. But if you do the local first, they will be able to transfer your skills over internationally, and you can work for the Red Crescent overseas. Otherwise, there's plenty of nonprofits that are always looking for volunteers as a starting point to get a paid job.
I would also recommend looking at programs like Doctors Without Borders. And I mention that because although people think, well, this is for MDs and stuff and people in the medical field, that's not necessarily the case. A lot of these programs are looking for not only obviously the public health side of the equation, but then also what are the social dynamics. For example, setting up social services, social programs to deal with, well, what comes with those public health interventions that they're trying to provide, which is often overlooked in some of these things. I'd also mention AmeriCorps has a huge both domestic, but then also international program related to disasters and emergency management that I would take a look at. Triparna, I think, wanted to say something as well.
Yeah, I think there are a lot of nonprofits, particularly international nonprofits, and they sometimes have even programs for interns. So you can do internship also as a student. And also, it's not just, as you mentioned, Jason, that it's not just the disaster management specialty required. Sometimes a lot of data is collected, data analysis goes in there. So a lot of different skills that they really require. And if you're interested in that, you can be a real asset to them. So just look around. So many nonprofits are having international missions, and you can pick and choose.
The only thing I would add to that would be that there are a number of faith-based organizations across a variety of denominations that always are asking and looking for personnel to do and do service work. And it's not, I mean, they are religious organizations, but they're not spreading, quote unquote, the word of whatever that faith is. They're there to help the communities dealing with disaster situations.
Just to add the last point, that even UN, World Bank, organizations like that also have some volunteering opportunity. They sometimes run program for students as well. So maybe somebody wants to really go overseas, that might be a good place to look into.
Thank you. Well, because we're just about at the end of our time, I want to thank our esteemed panel of people here today. We have thank you, Susamma, Judy, Lucia, Triparna. Thank you so much for taking time out of your very, very busy schedule to be here to talk about these issues. I know that 45 minutes does not begin to give this topic enough credit, but we wanted to highlight this within our programming for the section. And also I want to thank SWAPA for your co-sponsorship and really support in putting this webinar together. Without you, this couldn't have been possible. So thank you Romeo for helping to put this up together. This was wonderful, and thank you Caitlin. And I really appreciate all the insight that you've all provided today. We'll follow up. I will follow up with all of you. Maybe we can develop a working paper to really broaden and continue this conversation moving forward in a more both interinstitutional but also a more interdisciplinary way. So thank you all for coming today. Thank you to everybody out in the audience, and I hope you have a wonderful afternoon and try to enjoy the nice weather for the weekend.
Take care. Bye-bye.